right. Welcome, everybody. Welcome to our Bridges to Community podcast. My name is Sarah Turcotte, and I'm the Area Community Liaison for Bridges by Epic.
Hello, Sarah. I am Erica Lab, Director of Team Member Engagement and Culture for Epic Senior Living. We are so excited to have our guest here today, Suzanne Mcnamara. She is an elder care manager with over 20 years of experience in the field of aging. You don't look like you could be 20 years in. She's a registered nurse as well as a social worker. She has extensive medical knowledge and the background necessary to perform high-level care management services while also having the compassion and understanding that's needed to care for the complex emotional needs of the clients and families she serves. She has held many positions in the senior care arena, including positions in hospitals, assisted living facilities, skilled nursing facilities, as well as home care and hospice. She served as a clinical director for a nonprofit personal care attendant program for those on Mass Health, truly making her an expert in guiding and helping families. What also makes her so special for our podcast is that she lives right here in Westford, Massachusetts. Thank you, Suzanne. Good to have you on the show.
Thank you. Thank you for having me. I'm happy to be here.
Yes, I'm so happy for you to be here, especially being here in the wonderful town of Westford.
That's right.
And as Erica shared in your introduction, you really come with just a colorful background in senior care expertise. And I was really excited to have you come on the podcast today because, believe it or not, there's many people that truly don't know what an aging life care advocate is or a geriatric care manager. And before we really dive into things and the resources and support that you're helping the community with, can you just talk a little bit more? What exactly is an aging life care manager? What is a geriatric care manager?
Absolutely. And you're absolutely right that there are a lot of folks, both families and elders, but also those in the medical field that don't know. You know, oftentimes I will call a hospital or a nursing home or somewhere for one of my clients and they'll say, "What? Who are you? Where are you? What are you calling from?" They have no idea. So, you know, I usually give my little elevator speech. But so geriatric care manager, aging life care professional, it means different things to different people. In general, an aging life care professional is sort of an expert in all things aging. So I can help my clients, aging life care professionals can help their clients with anything, you know, to do with the field. So whether it be looking for a facility, whether it be, hey, I just don't know what I don't know. My mom is 82 and lives in her own home, but we need to start thinking about things. But what are those things? So we can sort of talk in generalities and make plans. And then, you know, we also dig deep into day-to-day issues. So I have a number of clients that I follow on a day-to-day basis and sort of truly manage their care the way that a family member might do for another client. And for various reasons, you know, that client might not have someone to do that for them. So we help with sort of big picture things and then right down to the nitty-gritty details of day-to-day life. So there's varying levels of involvement for me and my clients, just depending on the client and the family and the need.
Yeah, I was just thinking, I just saw a geriatric care manager that we know from the community. I was at a doctor's appointment and was in the waiting room and saw her there with a client, you know, just kind of hanging out and having great conversation, but was able to manage the appointment, which was really manage the waiting room and like manage the, you know, it was like a long way. I think actually it was like for blood work or something. And we were like all waiting. And it was like, I was getting impatient and she was there with an elderly client, presumably. And, you know, it was like, gosh, like getting her water and making sure she's okay. And it's really such a great service that like that big general thinking, but then also like the nitty gritty of like, you know, the appointments or shopping or whatever. Right. So that's great.
And I don't think that family member caregivers or people, I should say, people really don't know what a family member caregiver does or the extent of time and energy a family member caregiver has to give until they're actually living and breathing it. And it doesn't come with the handbook. A lot of these situations might come up suddenly because of a health crisis or accident. Sometimes there are things like we work in the world of dementia where there's this gradual incline of symptoms, you know, resulting from their dementia that they are just really don't know what to do. Right. So just, you know, what are some of the concerns or challenges that a family member caregiver is facing when you're meeting them?
Yeah. So it's so varied. And And so the way that I sort of describe it to people is I meet each client and family where they're at. And that may be that they are starting out in this. My mom is 85, living by herself, doing great. But what are some of the things we need to think about long term? So those are sort of more of the planning people. I call them the planners, where nothing has really happened, but they know there's some changes coming. And hey, what should I be aware of in the future? And what resources are there? And how do I even start to think about paying for these things and all of that stuff? So those are sort of some of the concerns for the planners. And then there's other folks that may be in a different space with their loved one. Maybe they already know they need to find a facility, but you open up Google and you type in senior care in your area, and it's so overwhelming what you get for a response. And how do you even start thinking about that? And which community is appropriate? And I've heard all these terms: independent living, assisted living, memory care, continuing care, retirement communities. What does all that mean? And how do I sift through, where she would need to be, and who do I get in touch with, and do they come to the house? All of those things. So it might be families that are already in that sort of search process, but it's very overwhelming. And then there's other clients that I really meet during a more acute period where, hey, everything was going along okay. All of a sudden my mom fell and broke her hip and then had pneumonia, and she's now in rehab, and gosh, we're not really sure if she can go back home. And can she go back home? And does she need home care? And what might that look like? And how do I find that? And how do I pay for that? So it really just depends. I have clients that, I get referrals from so many different people, so many different areas. So I meet clients wherever they're at, and they're at very different spots,
Absolutely.
Some at the beginning, some right in the middle of a crisis that we have to get through. So it just depends.
And a lot of times the aging life care advocates like yourself, you come with a background of nursing, with social work. And I think for families to really understand this is your field of expertise. You know what questions to ask. You know what you're looking for. Erica, you mentioned the example of seeing one of our geriatric care managers in your own doctor's appointment. I mean, the relief of a family member caregiver having a professional like a nurse to go into the appointment, not just the convenience of getting them there and making sure they're well cared for, but actually taking notes in some of these appointments and having someone really, what does that mean? The jargon that comes out, the medical jargon, and really breaking it down so family members are educated and feeling like they're making good choices for their loved one. I don't think people really realize that benefit. It's more than just coordinating.
Yeah,
things.
more than like a ride.
Yes.
Yes,
so much more.
We always have to share that with a family to say, when we're making a recommendation, hey, even friends now will call me and I'll be like,
yes,
I think you're looking for, a care advocate, or a GCM. And so to explain the difference and the expertise is huge. It's very sad that we don't, as just humans or Americans, we're not educated to what it's going to be like to care for aging loved ones. No. It's just all of a sudden you have this second full-time job for most of us, and you're caring for someone and you don't know any of those things. And so if you're able to engage a care manager, that takes a lot of the guesswork out of it. Right. And so, spending a little bit of money up front is well worth it because you're going to save time. You're going to save yourself taking the time to learn everything, and it is a full-time job. I mean, we've all here been doing it for a long time. And it's still hard to navigate. So I think it's such an asset to a family. If a family has sort of missed the window of the planning phase, what are some, do all the time. Which they do all the time, yeah, I'm sure. But it's not quite, maybe not emergency. Can you describe for our listeners, signs and symptoms of burnout, caregiver burnout? Because I think sometimes we think we're superhumans and oh, I'm fine. But what are some signs that it's not going well?
Yeah, that's a really good question. And oftentimes that is when I meet people, is during that caregiver burnout acute phase. And, same as burnout with anything else, lack of sleep or possibly, too much sleep, indicating maybe some depression and anxiety. Brain fog, not being able to keep up with day-to-day tasks, irritability, things falling through the cracks. Maybe you're having some decreased work performance yourself because you're having to care for a loved one. And like you said, I think a lot of us feel like we're superhuman and we can kind of just push through, and you don't realize necessarily when it's getting to the point where, oh my gosh, I cannot push through and this isn't good for me or my loved one because I'm not really doing a good job at anything.
Right.
And that is oftentimes where I meet folks and, have to walk them through the resources available to be able to get some help so that they can take care of themselves as well.
Yeah, because self-care is huge.
Huge.
Like it's not just like, can you get your loved one to their appointments and can you get breakfast made and can you get, it's like, do you have time to live a life that is enjoyable for you?
Yeah.
It's not like going to play pickleball or going on a walk or a run is not extravagant.
Yeah.
Like that's important because if you are not caring for yourself, you're not caring for, and we know that the data is pretty clear that you cannot care for somebody if you're not caring for yourself.
And I see that a lot, especially with couples. So if there's we in the clinical world, we call them a well spouse, right? If the well spouse is the spouse taking care of the unwell spouse or the spouse with cognitive impairment or physical impairments, I see the well spouse having a really hard time asking for and accepting help.
Yeah.
Oftentimes they feel like it's, in a good way, they feel like it's their job. This is what they signed up to do, which is completely understandable. And they want to take care of their loved one. But I think they don't also realize that there are ways to take some of the burden off.
Right.
Without, you don't have to leave your position as the primary caregiver necessarily right away, but there are some ways to take some of the burden off. And some people just have a tough time taking that step.
Giving them themselves the permission.
Yeah.
And it's a great point. And, some of the caregivers that we're working with, whether it's the spouses or the adult child caregiver, they oftentimes don't realize kind of your area of expertise of how can they make things work better. It's not just because your loved one has dementia and has difficult signs and symptoms. There may be things that you could incorporate to help them at home to age in place there a little longer before they need that comprehensive care.
Right.
And I think, again, everyone's situation is so different and so unique that you're really bringing this kind of medical and social lens to the picture and trying to make these next steps and plans.
Right.
What are some of the challenges families are facing? So now you're working with families and you shared a lot of times you're seeing people in crisis mode. And I'll tell you right now in the world of healthcare, it's difficult. So what are some of the challenges you're seeing for families that they're facing with these crisis situations?
Yeah, so, I will say it's very different than it was doing this kind of stuff even 5 years ago, 10 years ago. Being in the hospital, being in a rehab, it's a tough place to be. And, I always tell people, whether you want to hire me or not, in this situation with how your loved one is, they need an advocate for this hospitalization. Whether it be me or whether it be you or another family member, I find, especially lately in the healthcare world, hospitals are full. Doctors and nurses are at full capacity always. I just had a client waiting for a bed. So they were admitted in the emergency room, and there were 40 other people in the emergency room waiting to be admitted in a great Boston hospital, So it's not that the doctors and the nurses aren't trying, but it's crazy in these places right now, which means that in terms of the challenges that people are facing, if you don't have an advocate there constantly talking to the team, I see it all the time. Things fall through the cracks. And it can be really, really simple things that have a great effect on somebody's health and well-being. So, I always say to people, it's not that I'm distrustful of the hospital, but communication can be really poor. These doctors and nurses are doing their best, and they're, we're near some of the best hospitals in the country, and they're doing amazing work, but gosh, they're really busy.
Yeah, and sometimes it's the little stuff.
It's the little things.
I just had a family member have a stroke, and he's okay, but they were like trying to ask him what he wanted for lunch, and he hadn't had a speech eval yet. So it's just like this miscommunication. Like he's ready to order a cheeseburger and fries, and like luckily someone was there to advocate and be like, I'm pretty sure he's on a no food by mouth. One of the best hospitals.
Yeah.
One of the best hospitals in the area. And they were like, oh, sorry. But like, those things are getting missed right now.
They are getting
unfortunately.
missed. And if you don't have someone there that really, either a family member that's on top of it or someone like me that knows what to look for, it can have some pretty devastating impacts. I mean, I've seen people just, they get a tray dropped off in their room and it's like, well, so this person can't feed themselves right now. And
especially
then in
with
an hour,
dementia.
The tray is going to get taken away and they didn't eat or drink. Well, then they're going to get a UTI and dizzy. And so it's these little things that, I'm not, I don't think it's anyone meaning to do this. I think it's just the hospital environment right now and the healthcare environment.
The bandwidth, They
don't have the bandwidth. So they need that advocate. So hospitalizations are really very tough right now. And it's also all the advocacy that comes with the day-to-day in the hospital, but also making sure then after a hospitalization that everything is getting followed up on. Because a lot of that is left up to the patient and the family to say, okay, here are the doctors you need to see. PT is going to call you. Sometimes they don't. Sometimes you got to make that call yourself. A lot of balls get dropped for various reasons. And unless someone is there really keeping track of all those balls, then it can have some pretty devastating consequences. So it's really important for people to, especially with cognitive impairment, but even folks without cognitive impairment, you're in the hospital for a reason. You're not at your best.
Right.
So you're not taking in all that information the way that you would if you were well. And so even for folks without cognitive impairment, but they're just going through a health crisis, having someone there to advocate and just make sure all those boxes are checked is really important.
Yeah, agreed.
No, it's very important. And I was also going to say is, again, you come from a medical background, so you are picking up on key phrases and what this information truly means. And I also think for families to have an understanding that, when you're working with an aging life care professional and they are a nurse, they are a social worker, they know how to connect with other nurses and social workers and doctors. Where a family member, as you were saying, they're anxious, they're stressed, they're not presenting as their best self. So a lot of times that causes for friction in communication. So just another benefit with working with kind of a neutral person.
You don't know what you don't know. And so having a professional is helpful. But you bring up family and dynamics. And I think that would be a nice entry point.
Because you don't need a crisis to need an aging life care member, that's for sure.
Right. And so we found, I'm sure a lot of times the family dynamics is such that distribution of, the work that needs to be done to support this person, things like that. Sometimes having you is a way to sort of, well, you can explain sort of how you can help with family dynamics in a caregiving crisis or a caregiving situation.
Absolutely. So I always remind people, because families often get very defensive about this kind of thing. They'll say, well, my sister might say this and do this. And I always say, listen, of the percentage of family members that don't have, families that I meet with that don't have some kind of difficult family dynamics is so small, right? You are... Whether you have a good relationship or a bad relationship with your siblings, you throw in an aging parent, maybe two aging parents, the dynamics there, it's rarely easy and smooth. There's always some bumps. And so I always tell people that it's normal. It's perfectly normal to have those family dynamics, because everyone's going to have a different opinion often on what the best path is to take care of your loved one, and then your loved one's going to have a different idea as well. So lots of family dynamics. So oftentimes I help to manage family meetings about all of that stuff. So, I've had quite a few clients in the past that we've had some very organized family meetings, and actually one a few years ago where I brought in from an elder law group some mediators to come in, because there were 7 children, very complex. The elders themselves were very complex. The family dynamics were very complex. So we brought in mediators, and we had, boards, and we were writing things, and we had goals to really try to smooth things out, because, I'm always thinking about my clients, but also the family. It's a whole unit. This is where my social work background comes in. It's a whole unit. And so we try to keep those, relationships as unfractured as possible, and we try to remind everyone that everyone's goal is the same, which is what to do for their loved one and keep them happy and healthy. You know, the way we get there might be different, but everyone has the same goals, what's best for their loved one. So I can sort of go in with an open mind, a clean slate, and try to sort of mediate these discussions, which can get quite heated. You know, we have people get up and leave the room, and that's okay, and come back and sit down and try to get through to a common place and to a common ground, which, you know, sometimes we do, sometimes we don't. Sometimes we have to say, listen, you agree to disagree. This is why it's also really important. And when I get to those people that are in the planning stage, I always make sure that they have actually designated folks as a healthcare proxy, a power of attorney, that they trust, because at the end of the day, we want to make sure that there is one or two people that are actually the decision makers.
Yes.
That someone has said,
Yep.
you are the one I trust of my 5 children to make my healthcare decisions.
And folks at home, we have a whole podcast on that. So check it out, because that's really important. It's all,
So
it all
important.
like meshes together for a positive experience.
Yeah.
So.
And as Erica shared, you want to make sure, as you shared, that this person is going to make those hard decisions to really fulfill your wishes.
Your wishes, right?
Your
Not
wishes.
anybody else's.
Right.
Just yours.
Right. And I will tell you, if you don't have that one person or 2 people and you have a family of 10 kids.
Yeah, forget it.
And I've had it happen. And if that elder has gone past the ability, you know, capacity wise to make that decision, it's very messy.
Right.
Really
Very
messy.
tough.
Usually messy, expensive, emotional. So you want to make those decisions first. But regardless of that, if, you know, there's a healthcare proxy, there's still going to be family dynamics, right? Everyone still wants to give their opinion, has a right to give their opinion. You know, the distribution of work and caregiving is never even. So there's always some, you know, my brother's not doing anything. My sister, this one lives here. This one, I'm the one that's here. So it's always something. And we try to, you know, I'm always open, and I always tell people I am more than happy to get together in person, or if these are people across the country, let's get together on the computer.
Zoom. Yep.
And yeah, one of the good things that came out of COVID is Zoom is, you know, it's so easy now and everybody does it. And it's great actually for what I do, because I do work with a lot of families that are all over the place. So it's great. But let's all come together and really let's just hash this out.
Yeah, that's awesome.
And like you said, the common goal is quality of life and good quality care. And I love that you're doing this for people in tough family dynamics. You're doing it for caregivers that are burnt out and really could use that support. I think of the solo agers that also benefit from a professional like yourself.
Yep.
I mean, honestly, just earlier today, I was visiting a hospital and heard about you, and you being there and just talking with the staff about how your client prefers to receive care. You know, their care is difficult. So to have someone who's been working with your loved one for so long, and now they're in this situation, to have that hand holding and sharing is really powerful as they're working through these notions.
And professionally, like, you know, at Epic Senior Living, we're always looking for as much supportive information in our discovery, and then also prior to a resident moving in. And it's so helpful to work with someone who, like, an advocate that's worked with this person for a while, because we just get, you know, like like a social work perspective and a nurse perspective, a medical perspective coming in with our care professionals. And it's just like makes for such a nice transition into like senior living, because you want the details. It's so important for each of us. And that's why advanced directives are so important and our wishes are so important. But we want to talk about how we want to live. And those, like, you know, your French vanilla iced with milk only, like, that's important, you know. And
let's
Sarah,
remember
that's going to be
that for
important for Sarah. Sarah's got to have that every
50
morning.
years from now, we'll remember Sarah.
She may have moved on from the French vanilla. We'll see. But we have to make sure that, you know, we all get those little things
really
that make life important.
It's really important. And I think
Life
a lot of
enjoyable.
times in healthcare in general, and this is sort of off topic, but those things get missed. And those are the things that make a difference for the person. You know?
100%.
I just went to see one of my clients, and he didn't have his glasses. Like, his whole day was off.
Right.
I'm like, he's in a facility. I'm like, guys, he needs his glasses.
Right.
You know, yes, he has dementia. Is he actually reading that paper in front of him? I don't know, but he wants that paper in front of him. And he
Right.
wants his glasses.
Right.
Yeah.
Let's get him his glasses. Just those little things.
Right.
Yeah.
And I love that. And I would just love, before we kind of wrap things up here, just the various types of support the caregiver that you're seeing they need. I mean, there's various stages that you're working, but what are some of the biggest support pieces that you're lending these families?
Yeah. So, actually, I just had someone send me an email this morning that said, she's sort of someone that I'm probably going to work with in the future, but she's not quite there yet. And she said, honestly, just knowing that you're there and you're going to be by my side gives me so much relief. And that is what I hear often, that because I see people in varying levels of acuity, right? Sometimes there's something going on, sometimes there's not. Most of my clients I'm still supporting throughout all of those steps, and they know that if they're my client, that I'm a phone call away. So if something does happen, whether it's big or small, I'm right there with them, partnering with them
Right.
to walk through this journey, right, if they want, right until the very end, So I talk to families, I do meetings with families, I in person, virtually, I sort of develop a plan individualized with each caregiver, with each family and client and caregivers, sort of tailored to what they need in terms of support.
Awesome.
Sometimes it's more from afar. Sometimes I'm just supporting that family caregiver from afar with broad issues. Sometimes it's actually supporting the client themselves with the doctor's appointments and with the care management and talking to doctors and all of that stuff. So it's just very variable.
Okay.
This is amazing.
Yeah.
And I would love for just the audience to know, I know you have a website. Could you share your website?
Absolutely. It is www, I probably don't need to say that, but kinshipeldercare.com. So it's all one word, KINSHIP, eldercare.com.
Awesome. And
Fantastic.
she is local again right here in Westford, Massachusetts, but also you can check out the Aging Life Care Advocates page.
Yep.
They're a great resource,
Yep.
most especially if you are out of state and maybe looking for someone like yourself
Yep.
in various parts of the nation.
Yep.
It's a great resource. And I can't thank you enough for being here with
I'm
us
so
today.
happy.
This is such helpful
I'm so
information.
happy to be here. Do we have 2 more hours to talk?
Yeah.
Because I could do that.
Well, we can have you back.
Well, I'll have to come back.
Sold. Suzanne Mcnamara, thank you so much for
Thank you
joining
so
us.
much.
It's great to be with you.
And until the next time on
Until
our
next
Bridges to
time.
Community podcast, thank you for being here.
Thank you so
everyone.
much for having me.
A pleasure. Thanks, everyone.